G'day everyone, Dr. Chris Brown here. Today we're diving into the link between chronic illness and mental health. They're deeply intertwined. When one suffers, the other often follows. But don't worry, there's hope. Understanding this connection can empower us. Imagine a friend feeling down because their diabetes is playing up, or someone struggling with anxiety on top of their arthritis. These situations are common. We can support our mental well-being when facing a chronic illness. Recognize the signs, seek help, and use the right tools. Let's delve into this important topic together. Equip yourself with the knowledge to navigate this complex terrain. You're not alone in this journey. Together we can work towards a future where both our bodies and minds are cared for. Let's get started. Let's make sure we're on the same page about chronic illness and mental health conditions. Chronic illnesses are ongoing health conditions lasting 3 months or more. Conditions like diabetes, heart disease, arthritis, asthma, and cancer. Mental health conditions affect how we think, feel, and act. These include depression, anxiety, bipolar disorder, and PTSD. Physical and mental health often overlap. It's a two-way street where each can influence the other. Understanding this relationship is the first step towards support and treatment. Now, let's talk numbers for a moment. The Australian Institute of Health and Welfare, or AIHW, paints a clear picture. Chronic illnesses are widespread, affecting nearly half of all Australians. That's a lot of us, right? And sadly, many of these folks also grapple with mental health conditions. The stats show that people with chronic illnesses are more likely to experience mental health issues compared to those without. It's a double whammy that no one deserves to face alone. These figures highlight the urgent need for greater awareness, support, and integrated care for both chronic illness and mental health. Remember, behind every statistic is a real person facing real challenges. These numbers are not just abstract figures. They represent the struggles of our friends, family, and neighbors. By understanding the scope of the issue, we can advocate for better resources and support systems for those who need them most. Living with a chronic illness isn't just about managing physical symptoms, it's also about coping with the emotional and mental toll it can take. Imagine the constant worry about your health, the frustration of limitations, and the fear of the unknown. These feelings are entirely valid and quite common among those facing chronic conditions. The stress of managing medications, doctor's appointments, and lifestyle changes can be overwhelming. The uncertainty of the future and the potential impact on work, relationships, and overall quality of life can weigh heavily on anyone's mind. It's like carrying an invisible backpack filled with anxiety and fear day in and day out. It's no wonder that chronic illness can increase the risk of developing mental health conditions like depression and anxiety. The emotional burden of these illnesses is real and should never be underestimated. Recognizing these emotional and mental challenges is crucial in providing the right support and care for individuals living with chronic illnesses. Remember, seeking help for your mental health is a sign of strength, not weakness. It's about acknowledging the challenges you face and taking proactive steps towards a healthier, happier you. Section 5. When the body suffers, the mind feels it too. Now let's talk about how the physical symptoms of chronic illness can directly impact mental well-being. Imagine dealing with persistent pain that just won't quit. It's like having an unwelcome guest who overstays their welcome, leaving you feeling drained and irritable. Chronic pain can disrupt sleep, limit mobility, and make even simple tasks feel impossible. Then there's fatigue, that constant lack of energy that can make you feel like you're moving through quicksand. It's like your battery is always running low, making it difficult to engage in activities you once enjoyed. And let's not forget about the physical limitations that some chronic illnesses bring. These limitations can lead to feelings of isolation, frustration, and a loss of independence. It's like being stuck on the sidelines, watching life go by without being able to fully participate. These physical challenges can significantly impact mental health, leading to feelings of hopelessness, low self-esteem, and even social withdrawal. It's crucial to remember that the mind and body are interconnected. When one suffers, the other feels it too. Real lives, real struggles, stories from the front line. Sarah, a vibrant young woman, was diagnosed with rheumatoid arthritis in her early 30s. A passionate photographer, she struggled with joint pain and fatigue. It became difficult for her to hold her camera. She felt trapped in her own body.
I felt like I was losing a part of myself.
John, a retired teacher, loved spending time with his grandkids. After developing heart disease, he feared overexertion. He started avoiding outings, worried about his health. These stories highlight the invisible struggles many face daily. Behind every diagnosis, there's a human being with hopes, dreams, and fears. Section 7. A vicious cycle, mental distress worsening physical symptoms. Here's the thing about the connection between chronic illness and mental health. It can easily turn into a vicious cycle. Imagine feeling anxious or depressed. These emotions can manifest physically, leading to muscle tension, headaches, and even digestive issues. Now imagine you're already dealing with a chronic illness. These added physical symptoms can exacerbate your existing condition, making you feel even worse. It's like being stuck in a whirlpool, where mental and physical distress feed off each other, dragging you further down. For example, someone with chronic pain might experience heightened pain perception when they're feeling stressed or anxious. Similarly, individuals with diabetes might find it more challenging to manage their blood sugar levels when they're struggling with depression. This interconnectedness highlights the importance of addressing both physical and mental health concerns. By breaking the cycle of negativity, we can improve overall well-being and create a more positive outlook for individuals facing these challenges. Stress, that constant feeling of pressure and overwhelm, can wreak havoc on our bodies, especially when it becomes chronic. It's like having a leaky faucet constantly dripping, slowly but surely eroding the foundation of our health. When we're stressed, our bodies release a surge of hormones like cortisol, which in small doses can be helpful in dealing with immediate threats. But when stress becomes chronic, these hormones can suppress our immune system, making us more susceptible to infections and other illnesses. Chronic stress can also contribute to inflammation throughout the body, which is linked to a wide range of health problems, including heart disease, arthritis, and even cancer. It's like having a low-grade fire smoldering inside, slowly damaging our tissues and organs over time. Managing stress is crucial for maintaining both physical and mental well-being. By finding healthy coping mechanisms, we can reduce the negative impact of stress on our bodies and minds, paving the way for a healthier and happier life. Now for the good news. Just as we can treat physical ailments, we can also address mental health concerns. And the best approach is a holistic one that considers the interconnectedness of the mind and body. Think of it like tending to a garden. We need to nourish the soil, provide adequate sunlight and water, and protect our plants from pests and diseases. Similarly, taking care of our overall well-being involves addressing all aspects of our health: physical, mental, emotional, and social. On the medical front, it's crucial to have regular checkups with your doctor, manage medications as prescribed, and follow a healthy lifestyle. But that's just one piece of the puzzle.
Therapy can provide a safe and supportive space to explore your feelings, develop coping mechanisms, and learn strategies for managing stress and anxiety. Cognitive behavioral therapy, for example, can help you identify and change negative thought patterns that might be contributing to your distress.
Remember Sarah, the photographer battling rheumatoid arthritis? With the help of medication, physiotherapy, and support groups, she's found ways to manage her pain and fatigue. She's even started taking photography workshops again, adapting her techniques to accommodate her physical limitations.
And John, the retired teacher with heart disease, he's learned to manage his condition through medication, a healthy diet, and regular exercise. He even joined a walking group, which allows him to stay active while socializing and enjoying the outdoors.
These stories of resilience remind us that while chronic illness and mental health challenges can be incredibly tough, they don't have to define our lives. With the right support, self-care, and a positive mindset, we can find ways to thrive, even amidst adversity. Remember, every step towards healing, no matter how small, is a victory worth celebrating. There is always hope, and there are always ways to reclaim your well-being. So, what have we learned today? Chronic illness and mental health are intricately connected, often impacting one another in a complex dance. But here's the good news. We're not powerless bystanders in this dance. We have the power to make choices that support both our physical and mental well-being. Remember, seeking help is not a sign of weakness, but a sign of strength. It takes courage to acknowledge our struggles and reach out for support. And remember, you're not alone in this journey. There are countless resources available to help you navigate these challenges and live a full and meaningful life. Take charge of your health, prioritize your well-being, and remember that you are worthy of a happy and healthy life. For more information and support on managing chronic illness and mental health, please visit the Australian Institute of Health and Welfare website. They have a wealth of resources available to guide you on your journey to well-being.